Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome to another episode. Today I'm with Dr. Tom Stone. He is an oral and maxillofacial surgeon practicing in Denver, Colorado. Tom, thank you for joining us again on the podcast.
Thank you, Grant. Good to be with you today.
Yes. So today we wanted to talk a little bit about kind of our ability to track referrals in our practice. So could you start us off by just telling us a little bit about how you see that going and maybe why it's so difficult and sometimes broken in the way we track referrals in our practice?
Sure. Before we go down that road, Grant, I just want to tell you what you're doing with this podcast is really fantastic. And I've enjoyed over the last couple of months since our first podcast, just following some of the conversations that you're having with industry leaders and influential people in our specialty. And I've especially liked the Roger Levin podcast. I'm a big fan. He's been very influential in my practice, and he's really changed. He really changed early on, changed the trajectory of my practice growth. I did disagree with him on one point that he made. He said that communication letters don't grow your practice, and so I disagree a little bit there, but I do agree that just sending letters through general email or putting them in a cloud somewhere, dentists don't go looking for communication letters. So I do agree with them on that point. But I think the delivery is what's important. If you put a communication piece in a dentist's hand with a banner notification, that's a very different experience, and that can be a positive touch point. I mean, you send a dentist a surgical release that's going to create productivity for their practice. That's a positive experience for them. And so I think Roger said it best: if they're not hearing from you, they're not thinking of you. Yeah. So I think putting that letter in the palm of their hand on their mobile device, then they're thinking about you. All right. So going back to your first question, I just wanted to get that in because I'm just a big fan of Roger's. But I think the traditional oral surgery practice, we're all busy. We spend thousands of dollars every year developing relationships, marketing to referring doctors, just building those relationships with the doctors and their teams. And then we take a very casual approach to referral management. And I think the day-to-day impact is, referral leakage, which costs a practice thousands of dollars, maybe even more than that. You kind of think, what's the cost of a lost referral, not just today or not just this week, but over the next decade?
For sure. Yeah, that's a good point. There's so much focus on getting the referral, on meeting new people, but then once we actually have people referring, are we tracking it? What are we doing with these referrals long term to be able to see what's going on with it?
Yeah, I mean, if you think about the average oral surgery practice, referrals are coming in through a variety of pathways. But for most surgeons, the referrals are scattered, they're disorganized, across emails, portals, cloud file sharing systems, eFax, websites, even text messages. People send you text messages with referrals. And so I think the result of that is that these referrals slip through the cracks.
Yeah.
And ultimately the most important thing is the patient. And when we aren't efficient in that, passing that torch from the referring office to the specialist, it results in patient care delays, poor treatment. And surgeons, they think that they're busy, but they're really offloading business to their competitors, and they don't even realize it. And when these referrals are scattered in all these places, it's really impossible for a specialist to accurately track, referrals. The teams, your teams waste hours chasing down lost referrals and missing information. So I think that's really the day-to-day impact.
Okay. And on the previous podcast, we talked about Dr. Talk is kind of your software and your online um, cloud presence there. How does Dr. Talk help with tracking referrals?
Well, I think a lot of people have tried to solve this problem and done a really great job. I think there's a lot of really great solutions. I think where our company is different than everyone else is in a few areas. Number one is, we know that timing is very important with a referral. You're in the restaurant industry. How important is timing and that relationship, that connection to your customer. So I think it's the same goes with referrals. An immediate notification. It's not that somebody at the front desk casually goes and, checks an email once a week or even just once a day or however often, or they have to log into a cloud to access referrals. That's not immediate notification. I mean, by the time you log into that email or that cloud, that referral's gone somewhere else. So I think the thing that makes Dr. Talk different is immediate notification. When a referral comes in, you get a toast message on your computer, incoming message from Dr. Stone. Dr. Stucki's team can just click, drag, and drop it. They can realize the referral immediately. I think another area where we differentiate is our use of artificial intelligence. AI today is huge. A lot of specialists and dentists aren't quite sure how to use AI in their practices, but this is something that's really changed the game for Dr. Talk, because Dr. Talk uses a proprietary AI filter that goes in and it finds the hidden referrals in your email, in your eFax, in your web referral systems. And all of those referrals land in one place that's visible to everybody on your team, whether it's on their desktop or on their mobile devices. And I think, Roger Levin, not to keep referring to Roger, but I think Roger had some great comments about winning. And he said, how do you win? And you make it easier than anybody else. So you make it easier to refer to your practice. I think he said, whoever makes it easiest wins. And, Dr. Talk makes it easy to refer, but also nothing gets lost or missed. And I think the biggest, also another point, is your referring doctors don't need to sign up for Dr. Talk. I mean, obviously it's great when they do, but they don't really have to change anything about how they work. They can just send the referrals however they want. Like they can send it through your email or eFax or website. So I think that's what differentiates Dr. Talk from a lot of people who are trying to solve this problem.
Nice. And can you walk us through kind of a real world scenario with maybe a delayed or lost referral and contrast that with Dr. Talk's referral process?
Yeah, I mean, again, busy OMS practices, your referring dentist sends you referrals through all these different, pathways. And, who in your office goes to all these places, the email, the cloud, the eFax, the website, to gather all of those referrals. And and then how often does that individual check those places? Is it, you know, each day or weekly? What if your front desk person who's responsible for that is on vacation for a week? If those referrals are buried in spam or hidden in a cloud file somewhere, by the time you actually go and find them, your patient's already scheduled with your competitor. And so again, just like in your restaurant business with timing, referral management, timing is critical. And I think, the NIH published a an article recently, and I think the number was 50%. So you're losing 50% of your referrals if you don't have those systems locked down, and if you aren't able to provide, a solution for the patient immediately. And I think you have to kind of put yourself in the patient's shoes. You go to a general dentist. The dentist says, "Hey, Grant, you need a root canal, or you need a tooth removed, or an implant placed. Here's a piece of paper." Your piece of paper goes in your purse or in your pocket. You go home, it goes to your desktop, and life happens, and the patient just doesn't really follow through. I mean, if they're not having pain, pain's a pretty good motivator. If they're
Yeah.
not having pain, then all their other life experiences kind of take over. And so, if you have the dentist, if the dentist is able to literally text your office and say, "Hey, Grant, we have a patient that needs to come over," and they can just click and drag an X-ray, and it pops up on your computer screen, and the referral's right there. You can realize that referral immediately. And like the NIH study, if you realize that if you give the patient a an appointment right then and there at the point of care, then they're going to schedule that and follow through. And so I think you make it easy for the referrals to refer to you, but your team sees the referral the second it hits the intelligent referral inbox. But ultimately, the patient is the person who wins because they're able to have the care that they need.
Very nice.
Probably
Yeah.
that's probably the best use case. And I know that was kind of a long answer, but I think that's probably how it impacts the patient day to day.
Yeah, that's incredible. Um, and then how does Dr. Talk turn these things into trackable referrals, using your intelligent AI software?
Well, if you have referrals in a lot of different locations, and I used to go to my EMR and I'd try to track things, but then there would be people who would send through our website, and that wasn't really counted. And so, how do you really have accurate tracking if all of these pathways don't converge into one inbox? Then your numbers are off. Your data is not accurate. And if you have inaccurate data, you really can't run an organization or a busy practice. So, we call it the intelligent referral inbox because number one, it's secure, it's HIPAA compliant, it has an AI powered system that consolidates all the referrals into one place, one dashboard that's viewable on the desktop. It's viewable on your iPhone or your Android device. And again, the proprietary AI technology, it digs through all the spam, all the garbage emails, and it finds those referrals, and then it sorts them, it prioritizes them, and it tracks them in real time. So you literally, none of these referrals get lost, they don't get missed, and just as important, they don't get delayed. Back to timing. Timing is super important. Um, so that's really the solution that Dr. Talk provides, and I think that's why there's been so much excitement around this intelligent referral inbox.
Yeah. What a valuable software to be able to find those referrals that are coming in different sources and different emails and texts and things like that. That's tremendous to be able to track all that. What does onboarding look like for a small private practice versus a multi-location group?
That's a really good question, and I think onboarding is can be really complex, and then people kind of shy away from the onboarding process, or they just say, "I don't have time to do that." And I think that's why at Doctor Talk we've made it super easy for the referring doctor to onboard. For a surgical specialist, or for a dental specialist, it's literally our customer service team is able to onboard a private practice or a multi-location group in a matter of minutes. So we've really tried to simplify that for the clinician. We're all busy and we don't have time to learn a new software or download things. And I think that's what also makes Dr. Talk unique is your referring doctors they don't have to onboard to anything. They just can keep referring to your practice the way they usually do. Now, what we've noticed over time is they realize how operational efficiency between practices really drives better patient care. And so over time, they kind of get tired of secure emails, and they get tired of, you know, digging through email inboxes, and maybe having to go to a website and then navigate into a referral system. So what they end up doing is they end up downloading the app because they realize it saves them time. And then there's that connection between the specialist practice and the dental practice. And that's really the vision of what Dr. Talk's trying to do is create a digital community around the specialist, so that rather than everybody being siloed and delays with patient care and referrals leaking or getting lost, that we have a better system with our referring doctors. And then I think the patients perceive that, and it just elevates the standard of care in our community. So, that was a long answer again, but I think, onboarding, it's a very complex process, but we've really tried to simplify it and made it incredibly easy to get started.
Yeah, that's fantastic. What are some of the measurable, I guess, improvements or benefits that a practice could potentially see in the first month or two of using this?
Well, we actually track, practices progress once they get on Dr. Talk. And what we see is practice growth anywhere from 15 to 20% year over year, the first year that an OMS practice starts with Dr. Talk. And so I think the reason why is because early on, they dramatically increase the referral capture rate. Faster response times means, higher referral capture rate, higher, case acceptance, higher just appointment conversion. Second is you get, real-time metrics. So you're actually able to monitor that no matter where you are. If you're on the golf course or at the coffee shop or in the lounge at the airport, you can get those live analytics on your phone, and you don't have to put in passwords. There's no portal logins. You just have instant like insights at your fingertips. And I remember spending, hours digging through data on, on my EMR system. And now being able to have those insights at, in my palm of my hand has been a game changer. Third, I think security after the ADA letter came out last year, we all have a little bit more vigilance about security with patient healthcare. Let's actually talk about that for a bit, because I think a lot of these systems claim to be HIPAA compliant, but what does HIPAA compliant really mean? I mean, it means a known sender, a known recipient. So it's not just a practice, but it's an individual has to have responsibility for sending that and receiving that document. A BAA, you have to have a business associate agreement. So a lot of practices send information back and forth, but there's no business associate agreement. Obviously, bank level encryption in transit and at rest is important. I have a lot of colleagues that use WhatsApp. WhatsApp is a great communication tool, but it's not HIPAA compliant. It has encryption, but encryption does not mean HIPAA compliance. And so I have these colleagues sharing, private healthcare information, and yet that's a huge risk for any practice or organization. And the way we've overcome that with Dr. Talk is we've implemented this feature. It's called Persona. It's basically like TSA, where you can do a facial biometric, government ID, and you are on the platform. So when I'm in Dr. Talk, I know that you're Grant Stucki, and you know that I'm Tom Stone. You're not some, nefarious person from Eastern Europe or, some other country trying to hack into our system. So I think, having patient information protected and yet keeping the workflow simple is another measurable win. And then, finally, just having everything live in one place, to be able to view and prioritize and act on those referrals, all in a single screen, really streamlines the practice. So I think those are probably the measurable wins and why practices grow when they use our software.
Nice. So it sounds like some of the big, or two of the main big points of using this are ability to kind of streamline and find all these referrals that are coming in from different sources, and then the tracking side of things, being able to, once you've gotten the referral and seen the patient, go back and quickly be able to figure out what the tracking looks like, where are the referrals coming from, what practices are referring to what degree, and just looking at all those metrics.
Yeah.
Anything else there that you'd like to mention on this type of software?
No, I think you nailed it. Referral leakage reduction and then, timing and faster scheduling. I think fewer phone calls. You think about the hours wasted with phone tag and voice messaging in dentistry, and I think that this helps us, transcend organizational boundaries and just improve that workflow. So I think all of that leads to practice growth. Dr. Talk was built by healthcare for healthcare. We've been in this game for 25, 30 years, and we all understand the pain points that specialists and dentists feel every day. And our vision has really been to just eliminate that so that we can enjoy practice and ultimately just provide better patient care, which is really, I think, what we're all focused on.
Oh yeah, for sure. Yeah, so much better for the patient as well, just to be able to help them get their appointments in a more efficient manner. Like you mentioned, still, just the other day, I went to my primary care doctor, and she says, "Oh, you should go see a certain specialist." And then she hands me a paper. Here's a couple names of people we refer to. You could reach out and call them, and of course, I lose the paper, and then I have to call back a few weeks later, and it's like it's just very inefficient compared to the front desk. Let's say, like you're saying, using this software to be able to say, "Hey, I've already sent it to this referring doctor. They'll reach out to you," or maybe even, "I have the appointment already here, pulled up on my computer. Do you want to come on Wednesday to their office?" Things like that can just really streamline things and make it so much easier for a patient to actually get the treatment they need.
Yeah, and I think as a patient, it's very impressive if you're able to say to them, here's the specialist that I want you to see, and I've already texted them, and they have an appointment for you next Tuesday at 8 a.m. And we all say we want to be available. We've talked. I've heard that on your podcast. Multiple people have said being available and welcoming to patients and
Yeah,
you know always saying yes to the patients. That's really important. But then what is your system for actually getting the patient into the schedule? If
right.
you're available and then they're still handing a piece of paper to the patient, the patient, NIH study is 50% of those patients aren't going to follow through with scheduling an appointment. And maybe not only are they not scheduling an appointment, but maybe they've already scheduled with your competitor down the street. So, yeah, I think looking at it from the patient's perspective is important. I would be really impressed if rather than handing me a piece of paper, I get an appointment and then I'm already committed to that appointment and I'm going to follow through with my referring doctor's recommendation.
Oh, for sure. And I think it just makes you feel better as a patient to know that communication's there, that both your, generalists and your specialists are communicating well. They're talking with each other very efficiently. Because that's the other stressful point is you get to the specialist office and then, oh yeah, we never received the info from you. What is it that you need? That's just like a daily thing, I feel like, for so many patients, and it's nice to be able to, it's all very fluid, and the information's there at the specialist office.
Yeah, I mean, I think as a patient, you are impressed uh, when a healthcare provider or a service industry, like a restaurant, I keep coming back to that, but when you can leverage technology to make your customer or your patient experience better, that's a win for everybody.
For sure. Yeah, that's fantastic. Well, good. If there are listeners who kind of want to research this out and potentially use the software, where would you direct them?
Well, I think if probably our website, we have a obligation-free demo. Our website does a pretty good job of explaining what Doctor Talk does. We have we have a new blog that we just put on our website about the intelligent referral inbox. So I think that's probably a good source of information. And then our customer service team is fantastic. They'll go to the ends of the earth and really help Doctor Talk customers to grow their practices. Um, so yeah, so that's probably enough plugging of Doctor Talk. But I think referral management is more than referral management tracking is more than just the initial referral, and probably more than just the tracking who's referring to you and who's up and who's down. I really, I was I was lecturing to a specialty group um, a few weeks ago, and there were about 70 specialists, a lot of them oral surgeons and periodontists, all in a room, a lot of them doing implants. And I asked, how many of you have an implant treatment coordinator? And nobody raised their hand in the room. It blew me away. And I was like, why would you not have somebody who is not just tracking the referrals, but also tracking the consults? And so I think having those systems in an office is really essential. I mean, you think about Grant, think about your day. You start with your refer or with your consultations. By the time you get to the end of your consultations, do you even remember the name of the person that you saw at the beginning of your consult time? I mean, I don't, and I certainly don't I might remember their name, but I certainly don't remember the specifics of their treatment. And so I think having an individual in your office that can track those consults and having a system for it. It could be an Excel spreadsheet. It could be, a cloud file sharing system. Doctor Talk actually has those systems. So where you can track those referrals and then process those referrals and process those consults. And then when you have those in a database, then that individual can go back and follow up, 1 week, you know, 1 month, however often you want. And then what Roger does really great, Roger Levin's team does really well, is they empower you with the scripting when you follow up with that patient. And I mean, I think one of the things that Roger taught me early on was using doctor power. So, you don't just call the patient and say, "Hey, Dr. Stucki was wondering if you want your implant yet." I mean, it can't be that. It can't just be a generic script. There's actually an art form to it, and Roger does it better than anybody else. He talks about doctor power. So if I'm calling you to follow up, I say, and let's say Dr. Martell referred the patient to me, and you're the patient. Hey, Grant, Dr. Martell has inquired as to whether or not you followed up with his treatment plan. Not my treatment plan, but the treatment plan. Actually, it's your treatment plan, but the treatment plan that Dr. Martell gave you, he's asked us to follow up with you. So it gives you some accountability to your restorative dentist. I think that for patients is a call to action. They're like, there's some accountability to their dentist. My dentist has recommended that I have this tooth removed and that I have an implant placed. And so it reminds the dentist it's not just the oral surgeon or the specialist calling the dentist. It's actually some accountability to the dental office. I mean, that's just one very small piece of what, Rogers Levin's team does. I mean, that just incredible scripting, and it empowers that treatment coordinator to track the referrals, but also track the consults. So I think, referral tracking is a lot more sophisticated than just going back and seeing who's referred, who's up, who's down. It's also who's been in your office, have we followed up with them? So that anyway.
Yeah.
And I know, we're both part of organizations that have a lot of specialists. And, when you have private equity involved, they are very cost conscious. They want to, really reduce overhead costs. And, Roger Levin said to me once, he said, don't step over the dollars to pick up the pennies. And sometimes I think in organizations, that's what we do. We're not really investing in those individuals that really have the ability to drive growth in our practice. Those individuals, the treatment coordinators, the implant treatment coordinators, whatever you want to call them, they really have a finger on the pulse of your practice, and they're the ones that can fill your schedule. They can optimize your schedule and make you really productive. So I think I think that's wise counsel from Roger is, don't step over the dollars to pick up the pennies. So
Yeah, I agree. Especially with, like you're bringing up with the implants. I mean, we just had this discussion in our office as well, but there's many touch points there, and like it's a little more involved than your regular third molar patient, right? Especially if you're doing an extraction of a bone graft and then an implant in a few months, and then checking up on the crown a few months after that. There's many more points there potentially where patient could get lost, right, and not follow up on the subsequent treatment that's coming on. So anything you can do to help them streamline that, set up appointments, follow up, all of that would be so helpful for a patient to finalize and actually finish the implant.
yeah, and I mean, as the clinician, you don't have time to do that. I mean, you're all the things that you're managing in your practice, you just don't have time to do that. And so I think someone like that literally pays for themselves in a week or two, or certainly within a month.
Yeah.
And I think a lot of specialists were a little reticent. We're cost conscious, obviously, but we're reticent to invest in that individual or invest in that position because we're like, well, our overhead's too high. But when that individual can drive exponential growth, it's very enlightening, and it's just great patient care, and actually really great service to your referring doctors. That individual becomes a concierge, if you will, to referring doctors, to their teams. So, and I know that's one of the staples of Roger Levin's consulting group is having that individual and investing in them and training them. So,
Yeah.
Anyway.
Awesome. Well, thank you, Tom, for taking the time to run through this. At the very least, it gets that topic of just refining the process of intake of the referral and then tracking the referrals is a critical thing to our office long-term success. So thank you for running through that with us.
Absolutely.
I appreciate you. And then in our show notes, we'll put your contact info, website, all that type of stuff in case our listeners have further questions. But I appreciate you and look forward to doing more episodes with you.
Yeah, I think we've talked about a couple of topics that I think are interesting. One you had mentioned was immediate implants, extraction and immediate implants, or the emergency implant.
Yeah.
And then I think another topic that you had said there's a lot of interest in is running virtual study clubs where you can maintain engagement with your referring doctors and provide continuing education. So, I'll look forward to doing those if you'd like, and look forward to furthering the discussion, Grant. Thank you so much for having me today.
Appreciate you. Thank you for being willing to do that. All right. I'll talk to you later. Have a good day.
All right. Take care.
Bye. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayOralSurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.